It is something that everyone has dealt with growing up. In fact, over 96% of teenagers have had to deal with it. We're talking about acne. It doesn't end there. Studies show that over 50% of people deal with it as adults. Dr. Vijay is here this morning to tell us how to handle acne. Good morning, Dr. Vijay. This is something that doesn't just affect teenagers.
No, unfortunately not. In many of us, just like you mentioned, about half of us, this acne problem continues into adulthood, although in the vast majority of people, it improves significantly.
Sure. Can it be prevented by washing your face?
Unfortunately not. There's different kinds of soaps and different products out there that purport to prevent it. It may help, but it certainly doesn't prevent it.
Well, what about what you eat? Are there certain foods that make it worse?
It's felt that there are. What we all have to do is go and look into populations that aren't affected by acne at all. And although they have different genetics, we feel that the diet has something to do with it, especially in the Far East and the Polynesian cultures. If you go to those islands, the children and the adults there, adolescents included, they really don't have any acne problems.
How interesting. What can be done to treat it?
Well, the diet modification. Sure. So try to avoid as much cheese and milk. These Polynesian cultures consume a lot less of the cheese and milk products. That's one thing. If you make these lifestyle modifications and you still have acne, then certainly there's other creams and skincare products that help decrease the specific type of bacteria that causes acne. Because acne is really an infection caused by one bacteria that can be either treated topically with a cream, or if it's bad enough, needing to take some oral medications as well.
And if it is bad enough, you definitely want to see your doctor about that.
That's right, absolutely.
What can you do to, I guess, lessen the acne scars?
Once the acne is burned off, unfortunately many people have scars. If the scars are superficial, which means not that deep, if they're not pitted, then what you can have is you can do peels or dermabrasion or laser skin surfacing that'll kind of smooth out the skin somewhat. It's not going to make it completely smooth, but it'll improve it significantly. But if it's deep enough, then you have to have the surgical treatment where you actually excise that scar and close it, or you can go from underneath and then can actually divide the scar, lifting it up and put little fillers right underneath that can also help the appearance of the pits.
With the peels and those types of things, is it just one treatment or would you have to get multiple treatments?
Definitely multiple treatments. Peels and dermabrasion, that's really something that everybody should do on a consistent basis to improve the health of their skin and their look and their outlook also.
Thank you so much for being here this morning. We appreciate that. And if you have a question for the doctor, send us an email at news@KIIITV.com or post it to our Facebook wall. The Doctor is In segment airs every Sunday.